Sleep-numbing limb numbness occurs during the night as a result of pressure on the nerve pathway and interruption of blood circulation, which leads to the nerve being deprived of the oxygen and food necessary for it, so this leads to the interruption of the arrival of nerve signals to the area it feeds, and the longer the pressure on the nerve, the more damage the nerve gets, the more damage the nerve damage occurs, and with repeated numbness the affected nerve may damage the entire nerve. 3. The causes of limb numbness often do not indicate that there is a serious health problem, and in fact the specialist relies on the symptoms associated with numbness to find out the cause of numbness, and there are many health conditions and problems that lead to limb numbness, including, 4. A side effect of chemotherapy or anti-HIV drugs. Vasculitis. Chest outlet syndrome (TOS). 3. Means compression of the nerve or vascular beam between the first rib and the peritoneum, resulting in pain in the shoulder and neck area, and numbness of the fingers. 5. Multiple sclerosis. 4. An immune infection caused by damage to the membrane surrounding nerve fibers in the brain and spinal cord, causing many symptoms, including numbness and weakening of limbs. 6. Alcohol abuse disorder. 4. Is defined as loss of self-control when drinking alcohol, continuing to drink alcohol despite problems experienced by a person, the need to consume alcohol in greater quantities to obtain the same effect, or to suffer withdrawal symptoms immediately after stopping or reducing alcohol intake. 7. Diabetes. 4. Raynaud's disease. 4. Is a vascular disorder that causes coldness and numbness of the fingers and toes when exposed to low temperature or stress. 8. Lyme disease. 4. Lyme disease is a bacterial infection transmitted to humans by the bite of infected ticks. 9. Slipped discs, a condition that arises due to a problem with a disc or what is known as the vertebrae that separate the vertebrae of the spine, and this condition results in many symptoms, including limb numbness. 10. Guillain-Barré syndrome. 4. This syndrome occurs because the immune system attacks the nerves incorrectly, and one of the first symptoms is limb numbness and weakness. 11. Vitamin B12 deficiency. 4. Narrows cervical vertebrae. 3. Stroke. 4. Is defined as the death of part of the brain cells as a result of hemophilia, an emergency that requires immediate medical intervention, symptoms of difficulty and heavy speech, problems of understanding and absorption, paralysis and numbness in the limbs or face, vision disorder, as well as headaches and walking disorders. 12. Transient ischemic attack or transient ischemic seizure. 4. Carpal tunnel syndrome. 4. Sjogren's syndrome. 4. Is a chronic immune disorder that affects different organs of the body. 13. The spinal cord was injured. 4. Spinal cord tumor. 4. Peripheral nerve pressure. 4. Brain tumor. 4. The injury of the humerus plexus. 4. An aneurysm in the brain. 4. The pallises of the thyroid gland. 14. Chronic thyroiditis. 14. An autoimmune disorder in which the immune system attacks the thyroid gland, causing its inflammation and insufficiency. Diagnosis of limb numbness is diagnosed as the cause of limb numbness during sleep by taking a sufficient history of the patient's health condition, and since when has the numbness begun, and whether a person has been infected in recent years, has been infected with a type of infection, or taken any vaccines in the recent period such as flu vaccine, in addition to asking the patient about the medications he is taking, and other information that gives sufficient perception of the patient's condition to help the doctor to reach the correct diagnosis. Then the competent doctor will perform the examination. The clinic, accordingly, requests the necessary medical examinations and photographs, and from the examinations and images that the doctor can request depending on the condition. 14. 1. Comprehensive blood count and shortest CBC. Measuring the level of blood sugar. Kidney function test, thyroid function test. Vitamin B12 level. Tox screen. Neuroconduction test. The lumbar puncture. X-ray. Computerized court. Mr. Eye and Shorter MRI. Angiography. Ultrasound image.